Okay, from one wonderful presentation, extremely meaningful, to what I know will be another one, and our last one for this healthcare track, building a strategic healthcare recruitment model, definitely close to my heart. We have with us Patricia Torigny, I did it, the SVP of HR Shared Services for Magellan Health Services, as well as John Wilson, the CEO of Wilson HCG. Thank you.
Thank you guys for all coming today. I've had the pleasure of working with Pat for years, and really excited to walk through what I think she has built, a pretty remarkable healthcare recruitment function. Welcome. So I think we were going to start with just some current challenges that both Pat and I see in the market, and I know Pat and I were talking earlier about one that's near and dear to her heart, being that efficient onboarding process.
Right. One of the things we track at Magellan are the frequently asked questions of our candidates, and especially in healthcare, because for a lot of folks in healthcare, it's a calling. It's not necessarily a job. And what we find as the most frequently asked question is about training and onboarding. These candidates are really passionate about what they do, and they want to make sure that they've got the support of the organization and that their managers are going to help them be successful. And for a lot of folks, there's a transition that's happening between maybe working in a doctor's office or a hospital to now in corporate, and it's really important to them that we provide them with training and support. So we actually are just doing a Lean Six Sigma project on our onboarding program, and we're redoing the whole thing so that we can really focus on a good, strong onboarding experience for folks that includes not just day one, who's going to take you to lunch, but 3 months into it, what kind of training and development are you still getting? So I do think that if there's anything a company can do to really help in terms of healthcare recruiting, is build that really good onboarding and development program.
And we've seen from healthcare traditionally be the laggards in a lot of recruitment modeling, and workforce planning being one of them. And so when we look at the market, and we look not just, John does a very good job, but many of our other healthcare clients and ones that we see in the market, understanding the numbers around and the analytics around recruitment, talent acquisition, and retention. And traditionally, and especially in hospital systems quite a bit, where it's almost we hire when someone makes noise, and we don't think about it. And so that is a big piece I've seen with Magellan. They do a very good job of understanding what that workforce is going to look like 3 months, 6 months, a year down the road.
Yeah, this is a really, I think, pretty telling statistics. The Healthy Careers 2015 Recruiting Hiring Trend Survey, what people feel are the most important things, or the biggest things they're worried about, are physician shortage and turnover. And that has a direct impact, obviously, on recruiting. I think if you have a really strong recruiting program, you can impact turnover. So I just think that's a really interesting statistic. So I kind of wanted to talk a little bit about this niche recruiting, because when you think about healthcare, I do think it is a niche. And the first thing I say is I don't think there's anything that's earth-shattering or new in recruitment in general. I do think, though, there's some basics that a really good recruiting department needs to be focused on now, and it's much more high touch. So what I would say is there's certain activities that your recruiters need to focus on and not others to make sure that they're meeting the need. The one thing that we have found really helpful is to redefine those key roles in a search, which is the recruiter, the hiring manager, and the candidate. Our recruiters are really master networkers. They are out talking to people constantly. We've made it easy for candidates to reach us through LinkedIn, through our job descriptions, our postings, and they have to be open to that. I think years ago it was sort of like a black hole. You sent a resume, recruiters didn't want to talk to anybody, but you have to be talking to people all day long. If the team's not on the phone, if we don't hear a buzz, that's not a good thing. They also have to be really good negotiators and have superior business acumen. They need to know your healthcare business and how your business makes money and what the growth strategy is. If they don't know that, they can't sort of share that with the candidate, and candidates do care about that.
A big piece for me is that, again, with healthcare, is that the focus in going back to in a hospital scenario, but with nurses, talent communities are most effective that we see with nurses, salespeople, and IT professionals. And many organizations, many of our clients are always open to having a talent community that focuses on sales and IT. And then for healthcare clients sometimes wonder, well, why are we doing this? We're asking them for something, to do something, and they don't work. And nursing is the easiest one to do it with. So as many of you know, you have nurses that are coming from staffing agencies, you have nurses that will come in specialty nurses, or your normal RN, LPNs. And what this does is you invite everyone into a talent community where they are part of your organization. So when people apply, we always say, especially with nurses, you're never going to reject a nurse who applies for a job at your hospital, ever. Never do that. Just keep the conversation going. Even if there's somebody who you don't want at that moment, you keep them in your talent network, you keep having conversation, whether that's just email marketing that's going to them. There's so much change that affects, in healthcare, that affects a nurse's ability to do their job or be better. So you have an opportunity in a talent community to actually continue to add them value, even if they're not working for you. And a example I would like to give when we have a hospital system in Texas, and nurses are also highly, they'll move to the next hospital or the next job more frequent than many other professions. And so the hospital system that we had, the competitor, small hospital that everybody poo-pooed as a terrible place to be, work, anyway, they raised the pay for nurses 17%. 110 nurses went to go work there in a matter of 2 months. So now we have the reaction of that was, how do we get them back and how do we keep the communication going with them? And most of them ended up coming back, but it was, if the talent community piece wasn't there and that ability to keep the conversation alive with them, we would have been in a really tough time of having to really start from square one. And Pat and I talked a little bit about earlier, but the employment branding piece and talent community is almost is irrelevant if you don't have a consistent employment branding. You guys have done a lot of work with that.
Well, we've had to, because we learned the hard way. So hopefully I'll share my story and you guys won't have this problem. But Magellan has, for the past 20 years, really been a behavioral health company. That's what we're known for. And about 2 years ago, we created a new product in reaction to the market called Magellan Complete Care, where we took sort of a combination of physical and mental health, and we created a new service. And that meant we had to recruit a different set of candidates, now not just licensed clinical social workers, but also nurses. And we did not do any branding ahead of time. So we're in the market trying to recruit nurses, and we would get things like, well, I'm not a psych nurse, why are you calling me? Or what is Magellan doing? I don't get it. And it made our job so much harder. So we realized that we had to get in lockstep with our marketing department, and we really are creating what is Magellan, what is our new brand, and everything is now about the new brand. The website, LinkedIn, people's profiles on LinkedIn. All of our employees are going to start to update their profiles to make sure that they have the same brand. And when our recruiters are talking to candidates now, they know exactly what our brand is and they know how to spell that. And it helps us because, again, this is a calling for some of these folks. They want to understand, well, if I join your company, what does that mean? How will I still get to affect people's lives? So that's a critical piece. And we're working with our marketing department. If you don't have one, I know folks like even Wilson does this sort of work for you, but I think it's important that you pay attention to that in the market for sure.
Oh, did you want to go backwards?
I don't know if there was anything else I wanted to mention. I think we hit everything. So again, this is another really amazing statistic. In healthcare, the new jobs created were 26,000 per month in 2014. And they were 17,000 per month in 2013. And I think that trend is going to continue. So when you think about just the growth in the healthcare industry, And that has a direct impact on recruitment. Someone's got to fill those jobs.
This is the scariest slide for me as somebody who obviously, as all of us do, needs to utilize healthcare at times. What we see from a talent acquisition perspective, healthcare is so far behind corporate America on how they get talent, retain it, and really everything, even workforce planning, every single thing in that talent suite, they're behind. And I promise you there's not a statistic out there right now that says salespeople are going to go from 26,000 jobs a month to 17,
Yeah.
or software developers, or anything. That is an enormous number that is going to put an enormous amount of pressure into the system that I think we will all face. And so our healthcare clients and the ones that are in the room, I think this is a real call to action of getting those pieces in place and getting them right, because it will in turn affect many of us.
Yeah.
Great, so this is the piece that kind of goes on to what I was saying, but what organizations can do, and I think the first piece of it is understand the market in which you're recruiting. We require our teams to do market analysis prior to beginning a search. So that even goes from just a hiring manager, so to understand what it's going to look like. You come into the conversation much more educated if you're asking somebody saying, hey, here are the role that you just opened up, here are the people who are hiring for this role as well. Where have you had people that are your top performers come from? And how do we build out a target strategy with that? Because getting them, the hiring manager, the leaders, to understand that this is a partnership, whether it's internal or external, you're in it together to get a common goal, brings them on board, and in turn helps. You can't go there without any data. So having that market data is very important. And discussing and understanding the trends that are going on in the industry. So, we see this all the time where an organization, what their profile is today changes 6 months down the road. Where they thought the person who is going to do X is great, and then they realized they maybe made a mistake in the hiring process and hired someone that didn't fit X, but they turned out to be a lot better than X. And then that profile changes, or business changes happen. And then the recruitment model has to be different. This also happens from an industry or market perspective as things change. I live in Tampa, Florida, and in the past 3 years, we've had Amazon put 10,000 jobs there. We've had Bristol Myers Squibb put another 2,000 jobs there. Time Warner put 5,000 jobs there. And the list goes on and on and on. And so the market for a couple of our clients that recruit the similar type of people, it's changed. So the whole way you have to go about it from that talent community perspective, really give people the value proposition on your organization is their strategy now. And before it was just put an ad up and people will come. Well, they're not coming anymore. And then as well as how compensation, and that's the last piece, that those of you that are working in large organizations, getting comp changed on anything is, it's not easy. And this is, as we talked about, this is not just healthcare related, but the compensation function inside companies is completely crazy. I see very few companies that actually have compensation departments or models that are fluid and dynamic, and the data is there at this point. It's not, we don't have to wait for Hewitt to come out with their survey next April to tell us what we're going to pay people next year. And it's all there, real-time data. And so as HR leaders or people, specifically with healthcare, because there is that movement, being competitive and knowing that is very key to getting the people who you want and then retaining the people who you have.
We just did that at Magellan. Every single job we have, we rewrote the job description, we regraded them, and we recomped them, just to make sure that we were competitive in the market, and also to make sure that our job descriptions were current and that what we were looking for was really what we needed. And then we're educating our managers as to now how do you interview a candidate to make sure that you're interviewing for this and this, not the old thing. That was a year-long project, but honestly, I think it's going to pay off, just given the competitive nature and just our own. We can see from our own trends how much our recruiting is increasing. We needed to do that to be competitive. So it's a huge undertaking, but if you have the capacity, I would recommend doing it.
It's so true. The way people use the career builders and monsters and all those things years ago was really to find candidates. Today, it's much more of a marketing spot where you want people to understand who you are and why they should come work with you. So when you did the rewriting of the job descriptions and changed the way they looked and felt as a applicant, recruitment is becoming a marketing function. And they know how to get a hold of you. 10 years ago, no one knew how to get a hold of a recruiter. You can get a hold of one. So it's all about marketing to them and making them want to come to an organization.
Well, this statistic kind of blew my mind a little bit too. So in the next 10 years, healthcare is going to create 1 in 3 new jobs that are out there, and over 5 million new jobs will be added by 2022. That's unbelievable. So, that doesn't tell you right there, you've got to be thinking in a different way in terms of your recruitment function and how you're going to attract those candidates. And then also from a strategic viewpoint with your company, there's only going to be so many candidates, so then you have to start thinking about what skills and abilities can we interchange, can we teach. So that's got to be part of your workforce plan as well, because you won't be able to find every single perfect candidate. They just won't exist anymore. So that has to be part of your strategic plan as well.
We have clients in Silicon Valley that want software engineers, and any of you who've done it, it is what this is going to look like. You can't find them and just off the street. First of all, they're not going to call you back. Second, they don't want to work for Facebook and Google. And I remember 4 years ago we were working with a client there, and everybody wanted to work at Uber. No one even heard of Uber at that point. But they were working with cool technology, and they were pre-IPO, and it was cool office space. That was truly the motivators. And so as we look at healthcare and how you differentiate yourself in the market, it's not always compensation or career path. It might be the facilities they work in, the type of people they're around, and really their perception in the market. We've done some informal surveys with our clients, and this is really people who we've hired. We do about 50,000 hires a year for our clients, and we did surveys to see what were you the happiest about with where you work. And one statistic we saw with healthcare is people had how important their perception of where they worked was to other people was important. I thought that was very interesting. A large medical manufacturer, a medical device thing. And the people who worked there, they had this great brand in the market, and people really respect it and love it. And the amount of pride that those people had by that's where they worked was so much different than many other organizations. Sales kind of rivaled it, but not nearly as much as healthcare.
Yes, I think here we wanted to kind of talk about some of the tools and technologies that are available to you to help in terms of recruitment. And the one thing that we've really embraced at Magellan are assessments. So we do a lot of assessments, skills testing for folks like claims, care managers, et cetera. Because for a lot of medical professionals, they've not had to sit with a phone and a computer and do their job. So we have to kind of test where they are, and that's helped us with our hiring. And then for senior level positions, we do a lot of personality assessments because we're trying to build a leadership culture. And again, a lot of these folks aren't business people. They don't come from that culture. So we need to kind of assess where they are and and then help them build the skills they need to become good leaders in an organization. So that's been really helpful. Not from a perspective of screening you out, we're not going to hire you, from the perspective of where are you now and what do we need to help you learn and develop to get to where we need you to be. So we use it from that perspective.
One interesting thing that Magellan does is when they bring in a new executive to the company, a recruiter reaches out to them within 30 days and says, who are some really great people who we should be talking to where you used to be? And then the recruiters reach out, they don't recruit the person, they just say, so-and-so just came over here and told me you are a person that we need to be contacting and staying in touch with. And then that kind of goes into a talent community.
Right.
And you just keep that conversation going. And then the amount of conversation that one phone call sparks between the executive who's now at Magellan, these 5 or 7 people who they recommended, and those 5 or 7 people's other close colleagues.
And that's where we're talking about recruiters as master networkers. They have to be willing to be on the phone and talking to people and nurturing that relationship. So anyway, and then I think the reporting and analytics, I know you hit on that, but that's really, really key from a lot of perspectives. We use reporting and analytics from market data in terms of if you want to move into this new state, here are some things you need to know about the job market. But we also help our managers understand this is how many interviews you're going to need to get a hire, or this is this is what these people are making out in the market, or this is how many people have applied and we're not hiring anybody. What's going on? You need the data now more than ever, I think, to help drive your recruiting processes. Where I think before a lot of it was gut reaction, or this is what we think or feel. It's really about the data that you can gather and bring that back to your business. It adds a ton of value in terms of directing your resources. So to me, that was a big one.
And a big portion of Magellan's business is bidding on contracts in
Right.
states, and they, I bet 10 years ago, weren't calling the head of talent and saying, how is this going to work? How are we putting
Right.
the cost talent? And now it's a big piece of the bid.
They actually will say exactly beforehand, if we win and it looks like this, what would the recruiting strategy look like and what would it cost? And they build that into the contract up front. In fact, they will also come to us when it's something really funky. For example, we just won a contract in Wyoming. Well, there's just not a lot out there. And they needed us to show them what would be better, Cheyenne or another city. And we did the research, and actually neither one was great. But the point was, there's no one out there, so you probably shouldn't do this. But the point was, at least we were able to give them the data to help them understand the challenges we're going to have out there, so that if we don't find your candidates right away, here's why you need it up front. So that kind of data is truly critical, I think, to the recruiting department. And I don't think it's something that has happened in the past. I'm not sure if they relied on that as much as they needed to, but now you absolutely need to do it, especially in this environment. We're talking about 5 million new jobs in the next 10, not even, what is that, 7 years away. So it's kind of crazy.
And the other thing with the reporting is having it in analytics, we like to see with our clients that are understanding the risk of their organization. So is having your hiring managers identify what risk looks like. So is somebody going to leave this company? How does that work? What are the factors? And every company is different. So many times an organization's risk will be about 20% of their workforce that are really truly thinking about leaving, or there's risk factors. So if a salesperson misses number 2 months in a row, or a nurse that was reprimanded, or somebody who goes on LOA, those are risk factors of that person potentially leaving. And recruitment needs to surround that, where you are recruiting on risk as it is open. And when the statistics that we see with our clients, it ranges from risk being correct, so a red risk we call it. A red risk being correct it ranges anywhere from the low 70s to the high 80s in percent of those people actually leaving the organization. And that's true workforce planning. And then when we see what those numbers were for healthcare, that's opportunity for engagement. So you aren't going to have the option of somebody who's disengaged finding someone to walk in and replace them. It is the opportunity for engagement. And so healthcare, more than anything, you can't afford in many cases to have recs sitting open for 30, 40, 50 days. So the engagement, really re-recruiting staff becomes critical. So that risk number, helps you from a recruitment perspective and a retention perspective, but you need engaged hiring managers, and that's it's HR's job sometimes.